Hello, this is Yahya Al Farsi again from Department of Family Medicine and Public Health at College of Medicine and Health Sciences at Sultan Qaboos University, and I'm going to present to you uh, the second part of the lecture about lean thinking in healthcare. Just to refresh your memories, the objectives of our lecture about lean thinking in healthcare were four main objectives. So we have these two lectures to give you some idea about what is lean thinking and what is in lean that is quite attractive and make lean thinking promising in order to achieve success. And why do we need lean thinking in healthcare? And how can we apply lean thinking in healthcare? So, in the first part of the lecture, we talked about four important items. First, we discussed in depth about definition of lean thinking, and we connected the definition to the healthcare setup. We also talked in details about the need for lean thinking in healthcare. So we gave specific examples about the challenges that we face in healthcare in terms of efficiency and best utilization of resources from the experience of patients as well as workers in the hospital. And when I say hospital, I mean all institutions in healthcare, whether they are hospitals or health centers. And also we talked about types of waste, ranging from waiting, motion, intellect, transportation, overproduction, etc. Also, we discussed in some details about lean tools. So we listed different lean tools and we talked in a bit of details about two tools, value stream mapping and 5S. So in this second part of the lecture, we are going to focus about challenges that we face in applying lean thinking in healthcare care setup, and also about how we can apply lean thinking in healthcare setup. Finally, we will give some specific examples about application of lean thinking in our local setup in Oman, especially at Sultan Qaboos University. Well, when it comes to challenges to application of lean thinking, you might be surprised that the biggest challenge is that waste is not recognized. This is quite strange, and the intuitive thinking would state that it is easy to recognize waste, and for any person should be able to, he or she should be able to recognize waste and identify it. You will be surprised in real life. Actually, people have difficulty in recognizing waste. And the reason for that because they get used to the local environment in which they work. Let me give you an example. So, in many hospitals, as I mentioned before, there is an issue with waiting time. So, in some hospitals, it might take on average 2 hours to see a doctor from the time a patient enters into a hospital. And you might yourself have experienced this. It took you maybe 2 hours to be able to see a doctor. So, if we have a particular hospital in which this is the norm, a lot of people would think this is normal and this is their expectation, so they will not look for uh, reducing the amount of time required to see a doctor. They would think that waiting for 2 hours is okay to see a doctor. Actually, it is not. And that kind of thinking should be changed and should be challenged. However, when in reality, when you start talking to patients and you start talking to doctors and other stuff, then you will find people even do not recognize that easily. So the moment if you think about applying lean thinking, you need to anticipate that the major challenge that you will face is that people do not recognize waste. Well, a major challenge to lean thinking, not only that people do not recognize waste, but also people do accept waste to the extent that they think it is normal and they would resist any change. And this is also surprising because if you talk to people and you tell them about a change that you are going to imply in the environment where they work or go, which will include reduction in waste, they might resist any change because they accept the level of waste that is available. So also we need to work on how people look at waste, what are their expectations, and we need to deal with that in order to get them engaged in whatever we try to do in terms of improving efficiency. Now, how can we apply lean thinking in a healthcare setup? It is quite important to realize that we cannot apply lean thinking by imposing it on people. Rather, we need to engage people in the whole process. We need to encourage people to be observant themselves. So they observe the environment of their work, they need to analyze it, and they need to come up with suggestions to improve it. We need to take them in a real environment and enable them to do these tasks. As I mentioned in the previous slide, we need to engage people, encourage them to be observant, encourage them to analyze their real environment and come up with suggestions for improvement. In this picture, for example, you see a leader who is the lady in red on the right corner of the picture. And this lady, the leader, has taken the staff of the hospital into the operating theater, the surgical operation theater, where she discusses with them the environment in the OT and how can they improve it. And as you can see, they take notes and they discuss the challenges while they are in the real environment of the operating theater. So they might discuss items like, for example, do we need all the equipments that are available now in the operation theater, or probably we can reduce number of equipments. Do we really need all this number of staff in the operating theater? Maybe we can still function well with less amount. What about the waiting time for people to get operated in the surgical operating theater? Is it acceptable, not acceptable? What can we do to improve the work environment? What about morning shifts and night shifts? What about shifts during daytime and during nighttime? What about shifts during working days versus shifts during holidays and weekends? All that kind of discussion will take place in the environment where in the operating theater. So people and staff will have better insight about the challenges that they go through if they discuss it in the environment rather than in a classroom, for example, or in a meeting room. Another example of engaging staff in observing the work environment, analyzing what could be considered as waste, and encouraging them to come up with suggestions to reduce waste is what you see in this picture. So we encourage the staff to go into the environment and act the way they act normally, but also the way they act in more challenged environment, so with less resources, with less time available, and they will recognize the difference between the normal situation and the situation where they have less resources and time. They will be able to assess the improvement in efficiency even with lower time available for them and with less resources available for them. As emphasized in lecture 1, in lean thinking, it is important that we deal with real data. In the previous lecture, I showed you this picture where they have depicted the movement of nurses between different departments in a hospital. So, and they were able to calculate in distance how much distance those nurses have been walking throughout the days, and in average it came to be something like 9 kilometers. So this is real data from real environment. In other pictures you see people walking around in the hospital taking notes about the place of the equipment and what is in the store, and based on that real data they will able to come up with conclusions, and those conclusions they will work on them and they will assess and find out what would be modifiable versus what is non-modifiable, and then come up with mechanisms of improvement to increase the situation or to improve the situation. In this slide, we show you the process of mapping the flow, the value stream mapping that I talked about in lecture theta 1. In the first lecture, and as you can see here, the person who is leading the team is involving all the staff in mapping the flow. So each one of them will have his own or her opinion, and they will get involved in active discussion to draw the value stream map. If you remember, I showed you the value stream map with drawings, with arrows, with lines, etc. That map should not be drawn by one person. Rather, it should be made by all people who are involved, so they will feel that they are engaged and they are part of the flow, and they will be able to identify the weaknesses or the bottlenecks, and they will be able to come up with suggestions to rectify them. When we consider applying lean thinking in an environment of healthcare, we need to think about 7 flows. There is patient's flow, family flow, provider's flow, medications flow, supplies flow, equipment flow, and finally information flow. So we need to fix the flow of patients, like the waiting time for patients. We need also to consider the flow of family members. As you know, family members come to the hospital. They need to spend some time with patients uh, as companies to the patients. We need to consider when they come, how they move, where they eat, where they park their car, how, so they will not disturb the service, how they get harm from being in the hospital, like they will get infections, nosocomial infections in the hospital. We need to care for the providers, and we mean by providers are the doctors, nurses, professionals like physiotherapists who provide the healthcare to the patients. Also, we need to take care of flow of medications, and this is mainly in pharmacies. So, when we acquire pharmacies, how we dispense them and what time of dispensing, so we avoid having quantities of medications that they are not used and they will expire, so that will be a major waste of resources for the hospital. We need to think about the supplies, whether they are in terms of equipment or supplies like even linen for patients, cleaning environment, etc. We need to think about the flow of equipment like X-rays, ECGs, CT scan, MRI, and use of them in the hospital. Finally, we need to be careful about the flow of information. So we know quite well that documentation of information is quite important in the hospital. So we need to trace the notes of doctors. When the doctors put the notes, how they reach the nurses and how they reach the laboratories and how they are executed and how they reach the pharmacies and how the pharmacist will dispense medications. So what happens to all of this information? In the following slides, we are going to give you more information about some examples of application of lean thinking in Oman. And in particular, we are going to focus on application of lean thinking in the healthcare system in Oman. Just before we go into the details, I would like to mention that the examples that I'm going to give you some idea about were originated from uh, a research project which was titled uh, Lean Thinking in Healthcare in Oman, and it was a strategic grant fund funded by His Majesty Sultan Qaboos, rahimahullah. So in that research project, lean thinking in healthcare in Oman, it was a collaboration between College of Medicine and Health Sciences and College of Economics in Sultan Qaboos University. And in that research project, we had several findings. Among the most important findings, it was found that in Oman, people have real difficulty in defining waste in healthcare. As I mentioned before, whenever it comes to application of healthcare, lean thinking in healthcare, people usually have difficulty in defining waste and in not accepting waste because they already had accepted it. And also in Oman, people had some difficulty in recognizing waste because they get used to it. So when we conducted this research, we came to people at Sultan Qaboos University Hospital. We also went to Armed Forces Hospital and in other Ministry of Health hospitals. We started talking to people about it, about waste, etc. So we needed to educate people in the hospitals about what do we mean and how they can recognize waste. But also among the important findings of that project, we found that people are eager to improve value. There is need to improve value in our hospitals. We also, from the initial assessment, we found there is quite significant amount of waste that people need to deal with, and people generally in our hospitals in Oman are willing to improve efficiency and they are ready for effective cooperation, which are really good signs for application of lean thinking in healthcare setup. In lean thinking in healthcare system in Oman project, we had several objectives, and several dimensions that we dealt with. One of them was emergency department at SQU hospital. So at that time, we got interested in assessing the average time from entering into the emergency department for a patient until that patient would see a doctor. And at that time, we were under the impression the waiting time was long. So we wanted to assess that and to come up with solutions or suggestions to reduce the waiting time or the total amount of time from entering to see the doctor. When we started the project, we collected a lot of information. So we talked with the doctors, with the nurses, with the staff at the emergency department. We were able to also come up with several items for each component of the emergency department at the time of registration to at the level of the triage nurse to the initial consultation with the doctor at the stage of investigations and workup and then to re-evaluation. And the idea here from this slide to show you how much information we need in order to apply lean thinking effectively. So based on the assessment that we have done in the emergency department at that time, it was in year 2015, we found out that the average time that for a patient to spend in emergency department from entering into the emergency department to the time that patient would see a doctor was 69.5 minutes or 70 minutes, i.e. 1 hour and 10 minutes. And at that time we thought we thought that is quite lengthy time and we need to come up with solutions so we can reduce that amount of time from entering into the department until that patient would see a doctor. So we worked on the data that we have collected, we analyzed them, and also we did several activities. Among the activities that we have done was triage redesign. And for your information, triage means it is the initial step that the patient will go through before he will be able to see a doctor. So in the triage, the patient will, after registration, the patient will be asked to see a nurse, and that nurse will take the vital signs like his blood pressure, his pulse, his temperature, etc. And she will ask him several questions in order to assess whether his case is urgent or non-urgent. So that particular stage we call it triage. And in this slide as you can see, we analyzed the layout of the triage itself. So we put all different components and steps for the triage stage, and we found out that on average it takes 2 hours for the whole process in the triage to be completed. And also we found it to be very confusing, the triage process. So we took this layout and the chart that we drew, and then we tried to come up with different layouts more efficient, and we came up with the second layout that you can see, which is the triage process after change. So we did not add anything, we did not take out anything, we only redesigned the different components. And based on that redesign, the efficiency improved and the time spent in the triage got decreased, and we will show you by how much later on. Among also the activities that we have done in the emergency department, we have applied 5S tool of lean thinking on placement of equipment. So in front of you in this slide, you see different pictures before and after. Before applying lean and after applying lean. If you look carefully at the picture under before applying lean, it shows the cabinets that are available in the emergency department, and you see the labeling of these cabinets. And you can notice the labeling is only in wording, so the label shows which equipment is available in each cabinet. And this is underneath it another view for another section in the emergency department, so all the labeling was in words. So what we did, after we applied lean thinking, instead of having the labeling in words, we took picture of all the equipments and we replaced the label which was by words with pictures. It is just a simple thing, but it made a big difference. As you can see here in the picture under after the second one, it shows pictures of different masks or different equipments that are required. And the idea behind that is in the emergency department, usually time is precious. You don't want people, doctors or nurses, to spend a lot of time just to look for which equipment they need to open, which cabinet they need to open. They need to look at the cabinet, and immediately if they see the photo, they will go straight away and pick up the equipment that they need. That's why having the photos instead of the wording was more useful and helpful to the staff. Here also we show you another example how we applied 5S tool in the equipment placement in emergency department before and after. So before we had the equipments, the cabinets with words, they got replaced with photos or pictures in the after, as you can see here. So it was so easy for people to locate whatever equipment that they want, and so they can take them straight away. Also, we applied 5S on equipments that are stored in the emergency department. So in the photo below, in under before, you can see it was a bit of chaos. So people will just put the equipments without sorting, not in a specific order. There were in piles, and there were equipments as well as some files, etc., all mixed up. So what we did, we applied the 5S and we encouraged people to sort things so they don't mix up. They don't put files with equipments, and they need to sort out each equipments based on each their type. And that's what had happened, and you can see now at the photo below under after how the equipments and solutions, for example, they look neat and in order. Another example of what we did by applying 5S for equipment placement in the emergency department, in the photo at the left before, you can see that the equipments were put on shelves, and also they were only labeled by wording without any specific order, and these were usable movable trays. So those trays, people will move them from one place to another. In the second picture, the small one, I'm not sure if you can see it clearly, but that tray where people put equipments is placed at the end of this photo, and people sometimes difficulty in finding that tray. So what we did in the after, you can see in this photo, we encourage staff to sort the equipments, not to put them all in one tray, but rather to categorize them in small trays. And on the floor, they have marked the floor with blue lines based on the size of the trays, and on the wall we put photos of the trays and with names underneath the pictures, and we encouraged the staff to put the trays in those specific places. And if they would move them away to help a patient, then the staff uh, will be encouraged to return them back to exactly that place. So other staff who will come after will not have difficulty in finding them. If you go to the emergency department, you still can find these arrangements and also the blue line marks on the floor. One of the items that also we focused on when we worked in the emergency department was the motion of patients. So how patients move in the emergency department. And what we noticed, so we have still here, we have before, again, we have before and after. What we noticed, some people have difficulty in knowing where is the pharmacy and in knowing where is the lab, in knowing where is the x-ray, etc. And at that time, there is no obvious indication about the location of these facilities. So in the picture, the small picture on your left, you will see on the wall, there is only a piece of paper on the wall shows this is the pharmacy. But how to go to the pharmacy, it is not clear. So what we did, based on lean thinking, we put marks on the floor, and they were colored marks. For example, for the pharmacy, we put a green line. So in order for patients to reach the pharmacy, they don't need to ask anyone. They don't need to be guided by anyone. They will be told, just follow the green line and it will take you to the pharmacy. And that had happened. And also we had the blue line for other facilities like the x-ray. So patients will follow the blue line. It will take them to that specific facility. So they don't need to waste time locating facilities. Also, they don't need to disturb staff asking about where is this facility and or where is the other facility. Uh, and it added or improved the smoothness of work in the emergency department. So collectively and based on cooperation with the staff and all these small changes that we have done in the emergency department, Alhamdulillah, we were able to contribute to reduction of the average time that the patient would spend from entering to see a doctor in the emergency department from 69.5 minutes, around 17 minutes, to be reduced to be 16.9 minutes, 17 minutes only. And the size of reduction was 76%. And at that time, a lot of people were able to notice the improvement in the functions of the emergency department and a reduction in time. Of course, this achievement could not have been done by one person or two persons, by all team who got included in this exercise, and of course the staff and doctors and nurses in the emergency department were the main factor in this success. From our side, we tried our best to document our experience in Oman, and we had several publications about lean thinking in Oman healthcare sector. In front of you, this is one. This is an editorial written for Oman Medical Journal. If you are interested, you can access it. It talks in more details about the need for lean thinking in Omani healthcare sector and what would be the recommendation and the suggestions based on our humble experience. Another publication, if you are interested in this topic, we have a paper about readiness factors for lean implementation in healthcare settings, a literature review. We review the literature related to how ready is the healthcare system for lean implementation with more focus in countries like Oman and other Middle Eastern countries. So, in conclusion, for this second part of the lecture, we talked about challenges to lean application, and we emphasized that application of lean thinking should be through staff engagement, and we gave examples about application of lean thinking in healthcare system in Oman, and also we gave an overview about some publications related to lean thinking in healthcare in Oman. Uh,